Great, good colleagues. Here we are again. In this video, before we go deep into the details of pharmacology, details of medicines, I need to challenge you one thing. What is really the first approach to treat an illness? Before medicines, what can you do? And you know that many of the illnesses we see in daily life can be treated without really medicines. You see, this is what we call non-pharmacologic modalities of disease management. You see, diseases can be managed in simple ways, really, most of the disease, really, without really needing for prescription or over-the-counter medicines. Let's take, for example, hygiene. Washing hands, can really prevent quite a lot of illnesses, and this is one modality for prevention of an illness. You see, like exercise and physical activity, and evidence also shows that having a minimum of 30 minutes of an exercise in a day is very helpful, or in a week, like for around 2 hours of walking or physical activity, or a simple exercise or moving your body here and there will really help in improving circulation and also in preventing a number of cardiovascular disorders. Not only that, even hydration, drinking adequate water is also very fundamental for us, for the blood circulation, for GIT health, for mental clarity. The other non-pharmacologic option could be having an adequate sleep, is also another important thing. You know that our brain has billions of neurons which are very active. Imagine when you talk with someone, when you do your daily routines, these billions of neurons work in harmony to ensure that your muscle coordination is intact, your visual, your auditory, all your sense organs function as a team. So, these billions of neurons also need time to rest, to reset. So sleep is a very important therapy for quite a number of disorders. Also, to ensure your spiritual and emotional health, sometimes also talking to your psychologist, talking to someone, talking to a spiritual leader, is sometimes very helpful in managing stress and mental illness. So what am I really saying? I'm just saying it's not only medicines. We have quite a number of non-pharmacological options. Take, for example, restricting salt intake is very important. And what they call it is also restrict the white things, like salt, sugar, fat. These are things that needs to be restricted. You should really restrict their daily intake, because restricting salt intake really is helpful to prevent from cardiovascular complications, hypertension, heart failure. The more in the salt, the more in the fluid accumulation in the body, and that will be a very big workload on your heart. It could also precipitate hypertension. So I will challenge you to look for what could be the other non-pharmacological treatment options, non-medicine, non-drug treatment options for your illness. People say drug and medicine, they are the same things, and they can be used interchangeably. Yes, usually even in health setups, when we talk, sometimes we use them so interchangeably, saying drug, medicine, just to give a clarity on what they really mean. You see, a drug is any chemical substance that changes how the body works, It could be caffeine, it could be an alcohol, it could be morphine, any of those chemical substances, for that matter, even poisons are drugs. But when these chemicals are used to treat a disease, to prevent a disease, they are called medicines. So medicines are drugs that have a medical purpose. Those are the drugs that are used either to prevent a disease or to treat a disease, or even to prevent pregnancy or to prevent an infection like vaccines. So it's a very interesting thing, and maybe you might find me as I talk saying drug, medicine, but remember, all those chemical substances you have, they are just drugs. But what makes this drug medicine is when it is used for medical purpose in either treating or preventing an illness. Okay, great, and see you in the next video as we talk more and more on this drug, on what they really are, what the different formulations of drugs we have, on how different routes of administration they are administered. And not only that, and also how the body really reacts to this medicines. Long before hospitals, long before pharmacies, ancient people used to rely on plants as a major source of the medicine. Even that still now, majority of people in lower and middle income countries, including most of Africa and the Asians, still we rely on what we call herbal medicines. I don't know what you call herbal medicines in your local language, maybe mitishamba, bahalai, kumena. There are many names locally people give to herbal medicines. But remember, plants still are very important for these communities because people try to treat themselves because of issues with access to medicine, access to health care. Cost of medicine, since they try to look for these alternative modalities of pain management, or modalities of disease management, or only pain, okay? But let's try to take the moment to appreciate how drug discovery shifted, and as plants as a major source of drugs. And in this few series of videos, we'll talk about the different sources of drugs. From where do drugs come from? And the major source of drugs are plants, and you can think of history like take for example quinine, which was discovered from the plant called cinchona, and that plant in ancient days is used to treat fever. Take for example the known anti-malarial drug quartum, which has artemisinin, and artemisinin earlier days is again used to treat fever. So you see, from Chinese traditional medicine is where we got artemisinin. Take the known pain reliever, narcotic analgesic, morphine, for example, which was the basis and which really shifted the thinking about pain management using medicines. You see, it also came from the plant referred as opium poppy. Maybe I would love to hear what you know about the different plants that are used in drug discovery, and which some of the drugs in the market. You can mention some of them in the chat, but what I'm trying to say is plants have been the major source of drugs.